Hi there, you're welcome to DemiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, as a subscription gift to you, we would like for you to download a free meal recipe that we do have here at DemiRx Care. So go ahead and click on the link down below in order to be able to download or view that. Thank you so much for watching and stay tuned. Hi there. So what is our topic of choice today? Our topic of choice today is known as UTI. So what is UTI? So UTI is pretty much a bladder infection. So it's a bladder infection that usually occurs when a bacteria gets into the urinary tract. And I'm going to post a visual of what that looks like up in this video. So urinary tract is basically where the urine drains from in order for us to pass that urine out of our body. So when this area gets infected, that is what they call urinary tract infection, which is also known as UTI. So what are the symptoms of UTI? So the symptoms of UTI include pain or burning sensation while you're urinating. This is usually a very painful or more of like a discomfort when you're urinating. So also another symptoms will be more frequent urination. So you might notice that you're peeing more often than normal, or you're feeling some heaviness around your bladder area. You feel like you have to go, or more of like a fullness in your bladder right after urine. So also another symptoms will be cloudy urine. So patients may notice more of a cloudy or a smelly urine right after peeing in the toilet, of course. Or patients may notice more pain in their lower stomach area. This is also a common symptoms of UTI. Also, patients may also notice some form of fatigue or weakness all throughout the day as well. So these are the most common symptoms of urinary tract infection, which is also known as UTI. So how can you diagnose that you have a UTI? So usually there's a urine dipstick that is sold over the counter, and I'm gonna post a picture of that in this video as well. That way you can get a visual of what to get over the counter for urinary tract infection. All right, so once you've noticed that you have a urinary tract infection, also you can also go to your local healthcare provider to get diagnosed for UTI. So usually they'll do some form of urine collection to test for that. So usually what they're testing in your urine is nitrite and also something they call leukocytes. So if they start noticing this in your urine more than normal levels in your urine, then you may be diagnosed with a UTI. So how do you treat a UTI once you've diagnosed yourself from home using the urine dipstick, or if you actually go to your healthcare providers? So definitely what you want to get when you have UTI is antibiotics. So the antibiotics are staple medication that are actually going to help treat the infection and get rid of that bacteria that is causing that UTI. So usually some patients are not able to see the doctor right away, and that is the reason for this video, to give you some options of what to take over the counter while you wait for your appointment, or what to take over the counter while you're before making that appointment to go see your doctor, to help offer you some sort of pain relief or some sort of treatment of symptoms before you actually see your doctor. So what is the #1 medication over the counter that patients usually purchase for UTI? And that medication is known as azo. So azo is also known as a generic name, which is called Phenazopyridine or pyridium. So this is a dye medication that is used to relieve UTI symptoms or UTI pain. And usually this medication is taken up to 3 times a day. And the more you take that medication, the more it kind of gets saturated in your bladder. And you may start to notice when you pee or when you urinate, you may start to notice some colorful urine as well. So this medication is known to offer pain relief up to 1 hour or within 1 hour of using the medication. However, you don't want to substitute this medication for your antibiotics. So you definitely want to make sure that you still get that antibiotic to help get rid of that bacterial infection while you're taking this medication. So how long can you take this medication for? So usually they recommend taking azo for only about 2 to 3 days. That way you're not masking that symptom. So that way you're able to know that you've completely gotten rid of that infection, and now you're not double guessing whether it's the medication that's actually stopping that symptoms from occurring, and that you've completely treated that infection. All right. So another medication that you can actually use to help treat UTI symptoms will be your over-the-counter Tylenol or Ibuprofen. This is especially great for patients who are not able to swallow pills and who would like more of an oral liquid form in order for them to be able to help with some of that pain relief that comes with UTI symptoms. So the over-the-counter Tylenol as well as Ibuprofen is actually able to offer some pain relief for that UTI that patients UTI symptoms that patients are experiencing, such as stomach or body discomfort. All right. So what is another medication to try over the counter? So this one can be taken as a pill form or more of a tablet form, and this will be Cranberry. So Cranberry can also help in terms of the UTI symptoms. However, like I said, Cranberry is more of on a prevention side, so you want to take Cranberry maybe after treating that UTI to help prevent further UTI. So Cranberry would not be your sole medication for treating UTI. So as I said, you want to make sure that you're getting antibiotic, and these other medications over the counter are just a plus to kind of help with the pain relief, discomfort that you are feeling with the urinary tract infection. And usually most times the doctor will recommend these medications for you to take. So as I was saying earlier, with Cranberry, you want to make sure that you're lowering the sugar content when it comes to taking Cranberry tablets. So you don't want to take a Cranberry tablet or a cranberry juice that's overloaded with sugar. As a matter of fact, to be able to stay on the safe side, you want to actually make sure that you're getting a Cranberry tablet over the counter. That way you're sure that you're getting Cranberry in the tablet form and you're getting the right amount that you actually need to prevent further UTI. Alright, so what is the last medication that's recommended over the counter? So this will actually be your probiotic. So once you're done treating that UTI with some antibiotic, taking some probiotic over the counter would help in terms of preventing further UTI. So what this actually does is it actually replaces the bad bacteria in your body and replaces them with the good bacteria. That way you're able to decrease the risk of you developing UTI in the nearest future. Alright, I hope this video was able to help. If you did enjoy the video, make sure you give it a like or thumbs up, and make sure that you subscribe to our channel here at Demi RX Care in order to support our community here at Demi RX Care. And if you have any questions or any concerns that you want us to make a video on, make sure you feel free to post that in the comments below. That way we can check it out and get back to you with a video regarding whatever condition or medication that you're taking. All right, thank you and stay blessed.